Lung ventilation, natural and mechanical. Mechanical ventilation is a respiratory therapy that is becoming increasingly popular around the world. When applied appropriately, mechanical ventilation is a very powerful and effective means of saving lives, a lot of lives, because it maintains vital breathing functions in an artificial manner. However, if applied inappropriately, mechanical ventilation may be equally powerful and effective in harming patients. Mechanical ventilation might be the most challenging of all clinical therapies, not only because the therapy itself is complicated, but because the therapeutic tool, the ventilator system, is complicated, as well. This is a fact which is not often recognized. The outcome of mechanical ventilation depends, to a great extent, on the specialist knowledge of the clinicians in charge. It is generally the case that the more the clinicians know, the better the outcome. This learning unit is one of the most critical in this education program. After studying the material in it, you should be able to explain what pressure, pressure gradient, volume, and flow mean. What respiration really means. How lungs are ventilated naturally. How lungs are ventilated artificially or mechanically. Mechanical ventilation is closely related to, and is dependent on, pneumatics, which is a branch of physics. So if you want to know about mechanical ventilation better, this means, not only what to do, and how to do it, but also why things are as they are or will be, you must thoroughly understand the basic terms and principles of pressure, pressure gradient, volume, gas flow, resistance, compliance, time constant. Pressure is a force against resistance or a force applied uniformly over a unit area of surface. Gas pressure can be expressed in various units. The most commonly used units in mechanical ventilation include bar, millibar, centimeter of water, kilopascal, hectopascal, and pound per square inch. Pressure gradient refers to the difference between the pressure at area A and the pressure at area B. If both areas are connected with a tube, the pressure gradient drives the air or gas to move from the high pressure area to the low pressure area. The gas movement is flow. Gas volume is a measure of the space occupied by a quantity of gas at a given pressure. Tidal volume and minute volume are two typical examples of gas volume. Volume is expressed in liters or milliliters. Gas is compressible. Under various pressures, the volume of a given quantity of gas varies. Therefore, a vast amount of gas can be compressed into a small gas cylinder. Gas flow refers to the movement of gas volume over time. Gas flow has two essential properties: direction of flow and rate of flow. Flow direction is determined by the pressure gradient only, while flow rate is determined by both the pressure gradient and the resistance encountered. Inspiratory flow refers to the gas flow towards the patient, usually expressed in positive values. Expiratory flow refers to the gas flow from the patient, usually expressed in negative values. The rate of gas flow is usually expressed in liter per minute or milliliter per second. 1 liter per minute is equal to 16.7 milliliters per second. At a low flow rate, gas tends to move smoothly. The resulting pattern is called laminar flow. At a high flow rate, gas tends to move unevenly. The resulting pattern is called turbulent flow. Resistance is defined as a force that tends to oppose or retard gas movement. Resistance is flow dependent. Whenever a gas moves through a tube, a given resistance is generated. Resistance is usually expressed in millibars per liter per minute. The level of resistance is determined by three factors. The first factor is flow rate. The higher the flow rate, the greater the resistance, and vice versa. If the flow rate drops to zero, resistance disappears. The second factor is the physical properties of the tube, including its length, internal diameter, inner surface, curvature, and so on. The third factor is the physical properties of the passing gas, including its density and viscosity. Heliox is a gas mixture of helium and oxygen. It has a lower density than air. Passing through a narrowed airway, heliox generates less resistance than air, resulting in a higher gas flow. This fact forms the foundation of heliox therapy. The relationship between pressure gradient, flow, and resistance is described by Ohm's law. Flow equals to pressure gradient divided by resistance. So, flow increases when the pressure gradient increases and/or resistance decreases. A balloon and human lungs have one thing in common: both are elastic, hollow and gas-tight structures. Their volumes change at different levels of internal pressures. Compliance is a measure to express the pressure-volume relationship of such structures. A simple physical model can help our understanding. Here we have two balloons made of the same elastic material. The wall of one balloon is slightly thicker than that of the other. Using a T-piece equipped with a valve, we connect the two balloons to a source of high-pressure gas. In this arrangement, the internal pressure of the two balloons remains identical at all times. Now we gradually open the valve, causing gas to flow into both balloons and the internal pressure to increase. As a consequence, both balloons begin to expand. Unsurprisingly, the balloon with thin wall expands faster than that with a thick wall. If we measure the internal pressure and balloon volume simultaneously, and then plot the readings on a graph, we get two different pressure volume curves. These two curves have different angles to the horizontal. These different angles show the different levels of compliance of the two balloons. In principle, compliance is a static property, and should be measured in conditions of zero flow. Compliance is expressed in milliliters per centimeter of water or liters per centimeter of water.